My name is Fjeldsted. I'm president of CPME, which is the organization comprising the national medical associations of Europe. I'm very grateful to be allowed to address you in this way, and especially to introduce to you the manifesto that CPME has made up for the coming elections to the European Parliament. We want to try and bring the voice of the medical profession into all areas of politics. For that reason, our manifesto contains some items that I want to mention to you. The main ones, in my opinion, being health in all policies. It is very important that politicians realize the importance of health issues and that the well-being of patients depends on, not least, the medical profession. Now, you being the future of the medical profession, of course, are of prime importance in this issue, and we trust in your cooperation with us in it. So we are encouraging cross-sectoral awareness for and also action on the determinants of health, to prevent disease and to promote good health in our countries. Another important issue that I want to elaborate a little on is professional autonomy. This is an issue that was worked on within the CPME to great detail. The idea being, of course, and the reasoning that it is the right of the patient to have an independent doctor, to have a professionally independent doctor. We can be employed, we can be employees, but clinical independence is all important. We follow guidelines, yes. We follow best practice, yes. But our clinical independence makes sure that we are not obliged to follow guidelines if the circumstances and situation of the patient require not to do that. Now, other points in this manifesto are about economic restraints. All of our countries have seen austerity measures, and we want to bring to the attention of politicians that austerity measures in healthcare will probably be more costly. So we want to try and warn politicians in these matters. We want also to advocate for a strong medical workforce, and that the strong medical workforce is key for high quality patient care. Now, patient safety is a big issue. That issue started, as far as I know, with the Danish Medical Association, became policy for the CPME also, and became a main issue under the Danish presidency of the EU. So it's a good example of a proactive policy that has had an effect in European politics. So we can, as doctors and you as medical students, be reactive, yes, but we can also be proactive. And I trust in the medical students that you use your influence, you use your education and your brains, and you will have a lot of influence in future Europe. So at the end, I wish you a fruitful conference. And to the President, dear Olga, I wish you all the best in your work as President, and ask you all to support the manifesto of the CPME towards the elections for the European Parliament at the end of May. Thank you and goodbye.